short webinar on Florida Medicaid physical therapy coverage. My name is Zachary Edgar, and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to assisting physical, occupational, and speech therapy practices and facilities. Members can access a wide selection of guides and sample policies on Medicare, Medicaid, HIPAA, TRICARE, and more, and state rules and regulations that apply to therapy practices. Members can also email me at any time with any compliance or billing questions or schedule a phone call. Please visit the website at therapycomply.com for more information. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. On the website, we have more detailed information on outpatient and inpatient therapy services, fee schedules and code lists, billing for non-covered services, information on qualified Medicare beneficiaries, and information on Medicaid managed care. Members can always request information or ask questions about Medicaid coverage and compliance. This presentation describes the Florida Medicaid fee-for-service coverage of physical therapy. Medicaid managed care companies must offer the same amount of care as the state, but can change prior authorization, personnel, and documentation guidelines. Medicaid managed care companies do follow state rules in many cases, but therapists should always double-check with the plan. Physical therapy services develop, maintain, improve, or restore neuromuscular or sensory motor function to relieve pain, acquire a skill set, restore a skill set, or control postural deviations. Services must be provided by physical therapists and physical therapy assistants who are licensed in Florida. For students, PTs may supervise physical therapy students while providing services to a recipient. The PT must direct the care, make all clinical decisions, and be responsible for the recipient's assessment and treatment. The licensed therapist must be present for the entire treatment time and may not treat another patient or engage in other tasks while supervising the student. These are covered services for all recipients, children and adults. It only includes wheelchair evaluations, so one initial wheelchair evaluation for every 5 years per recipient, one follow-up wheelchair evaluation including adjustments and fittings when the wheelchair is delivered, and one follow-up wheelchair evaluation including adjustments and fittings 6 months after the wheelchair has been delivered. Children under the age of 21 years, one initial therapy evaluation per year, one therapy reevaluation every 5 months, and up to 14 therapy treatment units per week, that's Sunday through Saturday, per recipient with a maximum of 4 units per day, up to 2 castings and strapping applications per day per recipient. Federal rule on early and periodic screening, diagnosis, and treatment. As required by federal law, Florida Medicaid provides services to eligible recipients under the age of 21 years if such services are medically necessary to correct, ameliorate a defect, a condition, or physical or mental illness. As such, services for recipients under the age of 21 years exceeding the coverage described within the policy or the associated fee schedule may be approved if medically necessary. That means those caps for the children are not hard caps. If services are medically necessary, there should be a prior authorization method to obtain those services if they are medically necessary. Florida Medicaid does not cover the following: developing and updating the plan of care, mileage and travel expenses, securing, installing, or maintaining therapy equipment, services that are not listed on the fee schedule, telephone communications with recipients, their representatives, caregivers, and other providers except for services rendered in accordance with the Florida Medicaid telemedicine policy, time spent supervising assistants and students, and treatment visits provided on the same day as the evaluation service. That's important one below. Most payers do allow you to do a treatment, at least a unit or two after the initial evaluation. Under Florida Medicaid, you cannot do treatment on the same day as the evaluation. Providers must develop and update a recipient's plan of care based on the results of the physical therapy evaluation. And the plan of care must include the following: the medical condition, including diagnostic codes, functional limitations, specific therapy to be provided, short and long-term therapeutic goals and objectives, medications, treatments, and equipment that will be used, treatment frequency, length, and duration, therapeutic methods and monitoring criteria, diet as indicated if applicable, means of demonstrating and teaching the recipient, family, and other relevant caregivers in coordination with other prescribed services. Providers must obtain prior authorization from the Quality Improvement Organization at least 180 days or upon a change in the recipient's condition requiring an alternation in services. And if the patient is under a managed care plan, you must obtain prior authorization directly from that plan. Thank you for watching, and please visit the website for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe, and we'll be adding many more videos soon.